Good afternoon, everybody. Welcome to Through the Eyes of a Physician, a new webinar series that we are launching for Aesthetics by Medical. We are very excited about having the Vivace out there in the field, and we're getting more and more users. And while we love to go out and promote it and tell you all about it, we felt like we really needed to let those that are using the Vivace be the ones to speak on its behalf, and really just have a platform for physicians to hear other physicians who have used the machine, their experiences, what they like, what they don't like, what's working. And we're very lucky this afternoon to have Dr. Bonakdar speak with us. She's been using the Vivace for a while now, and she's very happy. Her clients are very happy. But I think the more important thing is that she's going to be able to talk to you about her experience and give you her personal remarks, pros, cons, whatever, about the Vivace and how she can make it work better for her clients. So right now we're going to run a little video for you, and then Dr. Bonakdar is going to be talking to you.
Hi, I'm Dr. Monica Bonakdar, and I am a cosmetic dermatology expert. Today I'd like to talk to you about Vivace Experience. Vivace is a new treatment that combines the benefits of microneedling and radiofrequency into one painless, no downtime treatment.
I'm Liz. I've been with Dr. Bonakdar for 7 years. I am lucky enough that every time we bring in a new treatment, I am one of the lucky demos to try it. So I've had number 1 treatment. This is number 2 today. I am very excited. I can see improvement already from my first treatment.
The benefits of Vivace Experience are skin tightening, improvement of the texture and the tone of the skin. It works on fine lines and wrinkles. It actually works on acne scars and stretch marks.
It will give me microneedling or surfacing, so help with my pores and texture, as well as lifting and tightening.
The number of treatments depends on the condition we're treating. On the face, it usually takes about 4 treatments for anti-aging, but we could be doing up to 8 treatments when we are treating acne scars and stretch marks.
My skin started to look great within 1 to 2 weeks after the treatment. I could notice improvement in the texture, mostly in this area of my face.
So the science behind Vivace Experience is very interesting. There is the depth of the microneedles, and how far we adjust them to enter the skin depends on the condition we're treating. There's the radiofrequency delivery, and that also can be delivered with insulated and non-insulated needles depending on what we're treating, whether it's face, we're using the insulated needles, and if it's, for example, stretch marks and acne scars, we're using the non-insulated needles. The other thing that happens is that we're producing microchannels that stay open, and these microchannels are a way of introducing anti-aging serums into the skin, for example, platelet-rich plasma or PRP.
As someone who's been here in the office for 7 years, this is the easiest recommendation. We are all aging. We all want our skin to look as beautiful as possible. If you can do it with no downtime, see improvement as you go, it's such an easy treatment. You don't have to tell anybody you're doing anything. The secret is safe with us, and your skin will just look amazing.
So good evening. Thank you for joining us. My name is Monica Bonakdar, and I am in solo practice in Newport Beach, California. I came from a primary care background, and for the last 17 years, I've exclusively been doing aesthetics. And because of the long number of years in practice, most of my patients currently, I would say, are above 40, more like in their 50s and 60s. So one of the things that I have noticed is that at the beginning of my career, I was a lot more courageous and more willing to take risks to try out new technologies. And as I have more people to answer to, staff and patients that have followed me for years and years, I've become a lot more conservative about what I am willing to try. And I've been very happy about my experience with Vivace, and am going to share with you how that came about. So having an older practice, you know, my quest has been to keep as many of my patients looking young and feeling good about themselves. And I just felt like we had come to an impasse with our lasers and devices, because the objection that most people have is that they don't want downtime and they don't want a lot of pain. And prior to Vivace, the best I had to offer them was all therapy. However, that has some pain associated with it, not necessarily downtime. Throughout the years, I was using my CO2 laser and my Fraxel technology less and less, just because I knew that people didn't want to have downtime. So, and then on the other side were all these other patients who were extremely afraid of having any laser or device treatment. So they were just sticking with facial. So microneedling came along about 4 years ago, and we started doing microneedling on these women that were laser and device phobic. And lo and behold, within about 6 months of doing a monthly microneedling treatment with PRP, they looked like they had had a resurfacing treatment done. So when I heard about microneedling with radiofrequency devices, I was very interested in finding the right technology. And it wasn't until I listened to Dr. Tagizadeh discuss Vivace that I realized how much science has gone into the Vivace device versus other devices. So I'm really glad that I waited and I didn't jump on the bandwagon with the first microneedling RF device that I found. And so we actually purchased at the end of February. I usually do 2 big events a year, one at the end of February and one at the end of September. And I match the purchase timing of my lasers and devices with these 2 big annual events, so that I can introduce them to people in person and sign up as many people as we can for the devices. So we showcased the Vivace device at our open house, and immediately signed up about, I would say, 10 people. And the way we did our package pricing was that whether you do PRP or not, it's the same price. And that way I had all the decisions to make for the patient. The only 2 people that we ended up not doing PRP with Vivace was a breast cancer survivor who is also a scientist and didn't think it was a good idea to do PRP, and a woman who just said, good luck, but I don't think you're going to be able to get any blood out of me. So those are the only 2. The only decision they had to make was, do they want their face and neck, or face, neck, and chest treated? So we made it really, really easy. So when I'd listened to Dr. C discuss the way they conducted their studies for the FDA, they did every 2 weeks and between treatments. And so because I wanted to accumulate some photos as soon as possible, we asked our patients to come back every 2 weeks. So these people are 8 weeks later, just about done with their treatments. And I'm going to show you some before and afters on our Vizia to show you what Vivace can do. And for the most part, I can't say that anyone has been unhappy with their treatment. Every single person has noticed an improvement in their skin, and is very happy that they've had the treatment done. So okay, so here are some photos. All right, so the dates on this one are just about a month apart, and you can see that her wrinkles have gotten better on this photo. Can you advance? We have to, okay, so here's the next one. This patient, this is one treatment only, 3 weeks apart, and her texture numbers have improved from a feature count of 1,456 down to 1,139. You know, she's not perfect. She's got a long way to go, but to get this kind of an improvement on one treatment is amazing. Next slide. So this patient had a phenol peel before my time. Her face is beautiful, and she wanted to just do her neck, but she said, you know what, let's do the face and the neck together. And even with someone that doesn't have a lot going on, you can still see improvement in her feature count of her texture. We went from 1,085 down to 931 in, I believe this was also one treatment apart. All right, so currently what I'm doing with Vivace is face treatments as well as off-face treatments. We try and encourage as many of our patients as we can to incorporate the treatment onto their neck and their chest. Apparently, unbeknownst to me, stretch marks are a huge problem, and everyone is looking for the holy grail of stretch marks. We are using it on stretch marks, and the results are great, but I don't have a set of 6 treatments, and I figured if facial rejuvenation would take 3 to 4 treatments, I should forewarn my stretch mark patients into signing up for 6 treatments. And that's pretty much my experience with it. I would love to answer your questions.
Can I ask you a question?
Go ahead.
Can you hear me?
Yeah.
Hi.
Yes, I can.
Hi, this is Emmy, and I'm from Nashville. I wanted to, and I apologize, I missed like the first maybe 3 minutes of your talk just from signing in, but I wanted to ask you, the last I heard, well, when you started, you were saying that, you know, you had maybe one of the first microneedling with RF devices. Can you help me compare Vivace with the other ones that are out there on the market, like the Infinity? What was the one that you used? What was the first one that you used?
So I went from microneedling to just looking at microneedling with RF devices and not really being convinced that this is going to be a home run. So I actually did not purchase until I came across Vivace. I had looked at the Infinity, and the problem with these treatments is that when you do microneedling, it's a pretty simple, easy, not bloody, not painful treatment. But when you go to microneedling RF, all of that changes with some of these devices, and so the treatments were that I was looking at were painful and bloody, and I just had way too many devices in-house that had things that people objected to. Was really looking for something that was easy. So in my experience, you know, I tell them that the first time I tried it, I did my neck. I didn't have any pain whatsoever. And the next day I came to work and no one could tell that I had a treatment done. So I'm basically selling this as minimal discomfort, if any, and no downtime. And that's what has attracted so many people to the treatment.
Mm-hmm. Have you ever used just an RF device? For example, like the E-Matrix, which I think now they're calling it the E2. So it's a sub-ablative RF. And I wanted to see if you've used that, how would you compare Vivace to that?
No, I haven't. The only RF devices that I had used were the warm stone massage type RF devices on the face, like Pelave
Right.
and
Venus Freeze. Uh-huh.
So those ones don't hurt. And so I was looking for something that I could really promise these women that they could come see me every month and not have to be anxious about the pain.
Mm-hmm. Yeah, I agree. Well, thank you so much for answering my questions.
Sure.
I'll let somebody else answer questions, but
Okay.
I've had
There's
two
a
Vivace.
question.
What is it?
Go ahead.
Oh, I just wanted to say thank you that I've had two treatments done, one with insulated needles and one with non-insulated needles, and I too was just blown away. We had an unexpected out-of-town guest that evening, and I put makeup on, and we were waiting for a table at a nice restaurant, and nobody knew what I had just done. It was awesome. So,
Good. We do instruct our patients to wait 6 hours before applying any skincare or makeup. So there's a question from Marina that is asking, how many patients have you treated? How long have you had the system? So I think that we are probably on our, I would say maybe between 12 to 18th patient. And how long have I had the system? Since the end of March. And can you tell me your treatment parameters, treatment interval, average pulses per treatment, and average energy? So this is the way I start my treatment. I go by the parameters that the company has provided, and I tell, and we have it all programmed into the machine. And I tell them, on a scale of 1 to 10, I want you to be at a comfortable 3 or 4. Once you creep up to a 5 or 6, you let me know. It is not going to be detrimental for me to adjust your treatment parameters. That way, I feel like I've empowered them, that you don't have to have pain in order for this to work. And it almost psychologically gives them an edge, and so they can tolerate a bit more. And so if they tell me that, oh, this is hurting, I will first go down on the depth of the needle. And if that doesn't make any difference, I bring my depth back up to where it was and go down on the radio frequency. I prefer to treat them every 2 weeks, although in Southern California, everyone seems to have multiple residences, and so I just basically have to go with what their schedule is, and I will take them as they are available to me. Do you have any other questions?
So I would only say, what's your percentage of using guarded versus unguarded needles? Do you have any thoughts on that? Because I know we always get a lot of questions on when to use it, what's the best method, do you use a combination with the needles?
So obviously, if they're doing multiple areas, I'm not going to open up multiple needles. There is no need to do that with this device. And I pretty much know my patients and know their tolerances. And so if they are doing an off-face area, we will do non-insulated needles. If they tend to have very low threshold for pain, then I will use the insulated needles. And so far, it's worked out. We've never had to stop a treatment because they were intolerant of it. And the way I describe, pretty much if I can get someone excited about the treatment, they will sign up. So the way I describe this treatment is that we're all aging and we're all trying to do the right thing for our skin and our face. But if I take an inch square of your skin and put it next to an inch square of a 20-year-old skin, someone from across the room can tell me which one is the 20-year-old skin and which one's the older skin. And so it has a lot to do with our eye picks up on texture of the skin, and this is the best that I've come across as far as a treatment that can be ongoing to fix the texture of the skin without interfering with people's lifestyles. That pretty much gets people excited about why it is that they should do this. Okay, so Sharon wants to know, what are you charging for sessions or packages, realizing that we're all in different markets? Again, I kind of went with what the recommendations of my rep were. She said that across practices, one area is usually about $800, and people are doing packages of 3 to 4 treatments and discounting that about 15 to 20%. And so that's exactly what we did. When you add PRP to it, it adds an extra $400 to the treatment. And most recently, I am learning about other biologics other than PRP, namely the amnioaesthetic products that Dr. Taghizadeh represents. And those cost a bit more, but they give you a lot more growth factors than PRP. It's being used in regenerative medicine, and they are new to aesthetic medicine. What kind of PRP do you use? 2x, 4x, or greater, and which system do you use to generate PRP? Okay, so currently I'm using Eclipse PRP, and there are questions about many of these systems being not exactly platelet rich, but platelet poor, so PPP. I purchased a large inventory of them to get the best pricing possible. I am actually looking at other PRPs to perhaps substitute for, because there's so much that goes into collecting the PRP. You're talking to the patient and explaining the whole thing, and then doing the blood draw and not missing the vein, and then spinning it down and making sure that you follow sterile protocol, and you're not putting any of your employees at risk. And in an aesthetic practice, that's kind of like above and beyond what we're usually doing as far as risks are concerned. So my intention is to get the best product possible after I deplete what I have. And I have been looking at Dr. T's new PRP collection system, the Genius. My only reservation is that it needs 30 cc's of blood, and sometimes I'm not good at getting a 10 cc bottle filled, but I think that just is because I haven't drawn blood in forever. And when my staff does it, they do a better job than I do. So I will be switching my PRP system at some point.
Great. Well, if there are no other questions, I know we're getting close to we wanted to keep these brief, and but I do want to make sure that we've given everybody a chance to ask questions. So if there's one last shot at questions, and then we just want to mention the Vivace experience. The one thing that Aesthetics Biomedical does really like to comment on when we look at the Vivace is the fact that we really believe, as Dr. Bonakdar has said, is it's, you want your patient to feel good from the moment that they walk in, when they're excited about the treatment. And when they wake up in the morning, they want to say, oh, that was just the best thing ever. I look good, I feel good, and I'm off to work or out for the night. And so we do like to, we've got a great numbing cream that we promote to make sure that if you are pain indifferent or not pain tolerant, we've got something that there for you. And then we have the whole series of our Glide serums, our mask, which is incredible to eliminate the red. And it truly is, when you look at the photos there of being able to do the treatment, use the mask, and almost eliminate the red before somebody walks out of the office. And then, of course, the spray to make sure that you are, healing as fast as you can, keeping the face ready and moist. And then the balm in the evening to keep out the bacteria, just in case you might potentially, with the open channels, be subjected to having a response. So we really encourage you to look at all of those products as well to give that ultimate experience.
Just project, Marianne, and say that before we numb the patient, we actually ask them, so you understand that you're going to not be able to put any makeup or sunscreen on your face for 6 hours. And out of everyone that we have prepared before giving them an appointment, and then they've come to the appointment, we actually had one person that said, oh, but I was going to go boating after this. And so they left without doing their treatment because they needed to go and be in the sun and wear sunscreen. So my instructions are very specific that these micro treatment zones stay open for about 6 hours, and we don't want you to touch your face. We don't want you to put any products on other than what we're putting on your skin to go home with. And we use the Vivace Experience products, and we have had one person that sent a picture saying, I think I may be allergic to your numbing cream, just like all other numbing creams. And she had maybe two little dots of breakout. We've never had anyone have any problems because we're very adamant about them following the instructions. And that's part of why this has been such an amazing experience, is because we're providing them with all the tools that they need for success.
Okay, very good. There looks like there's a couple other questions in terms of, it seems that there are comments on the eclipse and are you not happy with it? And it sounds like you might have a thought on that. And then there's another question on, have you ever done a Vivace treatment and then a light pass with a fractionated CO2 laser on top of it?
Okay, so it's not that I'm happy with my PRP, but the more I learn about PRP, the more I realize that there are differences between different systems. And so my quest is to run my inventory down and find the one that gives the best results, that has the highest concentration. And I think that that's going to be the Genius system. I have to say that I haven't done Vivace with any other devices. Part of the reason is because most of the women that I have signed up have been people that have been seeing me for a while, and they're kind of tapped out on technologies, having tried everything else. So no, I haven't done it with a light path fractionated CO2.
So if there are no more questions, we want to thank all of you for joining us today. We plan to have these every couple months and try to have more and more of our physician and our practices that are using the Vivace come and speak to their experience. If you all have any ideas for a particular topic you might want us to address, happy to do that. Myself, just before this started, I had a Vivace treatment with unguarded needles on my face and no bleeding, no nothing. So, we may want to talk about, the use of guarded, unguarded needles and how they can benefit different skin types and have different impacts. So if you want to give us your ideas to drill down on specific topics, love to do that. And I just really appreciate Dr. Bonakdar taking the time to join us and to share her experience with all of you. And I appreciate all of you joining us and asking questions. And hopefully we'll do more. And again, I thank you all for your support of Aesthetics Biomedical and the folks out in the areas. I know a lot of our sales reps and support staff interact with you, and we really appreciate the service and the response that you give to them. So thank you all. Good evening.
Thank you. Good night.